there's the avoidance. Some people have a bad accident, they won't go back on a motorcycle, they won't get back in a car. The anxiety, the irritability, the real reactivity. And then the other part, some people have the negative feelings about themselves. So they start to feel depressed, they start to feel shame, they blame themselves for whatever happened. So those are the main four components of PTSD.
It can almost like freeze you in place. It's a paralysis because you're reliving this moment over and over and you get paralyzed essentially.
Welcome to Riding Counsel with Rich Jaffe, where the open road meets expert advice. I'm Richard Jaffe, an attorney and biking enthusiast, and this is the podcast where we dive into the world of motorcycling, safety, culture, charitable giving, and riding right. So, whether you're a seasoned rider or just getting started, let's talk bikes, the road, and everything in between. Let's ride!
Hello, and welcome to another episode of RidingCounsel.com's podcast of motorcycle law and charity, a guide to riding right. And today we have a really awesome, amazing guest, Dr. Beth Feldman, who is going to talk a little bit about the psychology of riding a motorcycle and perhaps the aftermath of the unfortunate happening of an accident. And I think it's a topic that we haven't really covered and something that really needs to be talked about. But before I get into that, I just wanted to introduce Dr. Feldman, or rather let her introduce herself. So Dr. Feldman, if you could tell us about yourself, and I'd love to hear from you.
Sure. My name is Beth Feldman. I'm a clinical psychologist and a relational psychoanalyst. I have a private practice in Plainview, New York. I treat teenagers, couples, adults. That's it. I have 3 dogs, and I'm a boater. I'm not a motorcycle rider, but I'm a boater.
All right. Well, that's good. That's good. This is all good. But I think you hit on something really important, and that's dogs, because I am a dog lover. I personally have a Shih Tzu. His name is Jet, unfortunately named after the New York Jets, who have lost, I don't know, every season since I was born.
Mm-hmm.
So that would be bad. But you have some dogs, I hear. So what kind of dogs do you have?
Oh, they're all rescues. I have a terrier rescue who was like a complete wreck, was in really, really bad condition for a long time, and he's just delightful now. He was like a real rescue because he was at this shelter for months and months and months, and nobody would take him because he would put his little mouth on anybody who came near him.
Oh.
And the other 2 are not real rescues, even though they're rescues, because like you had to fight off people to get to them. They're these cute little doodles. But there are passions.
Dogs do a lot.
What's
Yeah,
that?
dogs do a lot for us. They really do.
They do.
I know for me, they calm me, and they're always happy. And I just love being around them. So you get the same feeling?
1000%. They are my passion, and it makes me think of your passion when you start talking about motorcycles.
Yeah, it's great. It's great. So, so tell us a little bit about your background, your education. You must have gone to school for this kind of psychology thing.
Yeah. So I went to Brandeis University undergrad, and then I went to Long Island University for my PhD,
Mm-hmm.
and worked for many, many years. And then when my youngest went off to college, I decided to pursue analytic training to kind of keep my head out of the oven. So first I went back to get a certificate in working with eating disorders, compulsions, and addictions. And then I went for more formal analytic training.
All right. So you're just hash this out for me, because there's so many titles out there. People don't know what's what. So I've seen titles like health counselor, mental awareness counselor, something called a PsyD. I don't know the difference. Like, can you just tell us a little bit about some of the titles that are out there for different kinds of psychologists, or whatever they call themselves?
Right. Well, look, I think anything called counselor regarding the mental health field is going to be somebody without a tremendous amount of formalized training, hopefully with a lot of life experience, who gives a more kind of hands-on approach to helping you through something. A PsyD is very similar to a PhD. It's 5 to 6 years of training and schooling after college. The difference is the PhD has a research component. Usually it's 50-50. It varies within programs. The PsyD is not really research focused.
All right. So, wow. So you went through 4 years of college. You got to graduate there, and then you go on to school for psychology. Is that so? You have to get a master's before you get a doctorate? Is that how it works?
No, it's all one thing.
Okay. So how many years after your college degree do you have to go to school for?
Well, I took a few years off because they don't really want you right out of college.
Yeah.
And then it was a 5-year program.
Wow. So, okay. So it's another 5 years that you had to go after you graduated college.
Yes.
Wow. Wow, that's a lot of schooling. And then I'm sure you trained and you have a lot of experience. And I'm sure some of the patients that you might have treated in your private practice must have gone through some sort of trauma, whether it be from a motorcycle accident or somebody else that they know, a loved one maybe, somebody they really cared about, uh, being involved in such horrific things. So I'm sure you've seen these kinds of patients.
Yes.
Yeah. So, I know there's a lot involved, and one of the things, at least I see, and I think this is really important to talk about. It's not really spoken about a lot in the motorcycle community for a lot of reasons, which we can really talk about a little bit. But one of the things that I see is something that I term anxiety. So somebody if somebody gets really hurt as a result of a motorcycle accident, or their loved one gets hurt in a motorcycle accident, they say, "I feel so anxious." But what is anxiety? What is it exactly?
This episode has been brought to you by Riding Counsel. Don't forget to visit us at ridingcounsel.com.
Look, anxiety is your body and your mind's reaction to fear. I think anxiety is considered to be an irrational fear, right? So if we're worried about something, like you get a bad test result back, you're worried. That is a rational fear. It's a rational concern. A lot of people feel anxiety. They don't know what it's coming from, or they're anxious about going over bridges, or they have anxiety about snakes. Well, you don't have a lot of interaction with snakes, and bridges are pretty safe, and so it's considered an irrational fear. But what you're talking about is anxiety in response to a trauma, which is one of the main symptoms of PTSD, post-traumatic stress disorder. And, officially you need to have all of the symptoms, the main symptoms, to be diagnosed with the disorder. But, we understand that as people, we have some symptoms of this, some symptoms of that need attention. And when you talk about trauma, we've all had trauma in our lives of one variety or another. And in my field, we talk about big T versus little t. So little t are the mini traumas. You grow up with a highly critical mother who is, reaming you out in front of your friends. These are little t's. Or, you have a horrific breakup with a partner.
Right.
Like a boyfriend. I'm not talking about like a marriage kind of thing.
Right.
It could be like a little t. But a big T is where it's a severe trauma. And I always talk to people about, there are front burner and back burner things in life. And most of us, the idea of death or severe injury, it's a back burner thing, right? You worry about your health, you worry about your well-being, you worry about your mortality. But you don't go around thinking about it, and you don't assess your daily activities in terms of it. But when something happens that brings you face to face with death, with your mortality, with the possibility of being disabled, when something happens that brings you face to face with your lack of control and feelings of powerlessness, that can cause a severe trauma. that has really rippling effects.
Yeah, I often see this in other people, not necessarily the riders of the motorcycle, unless they've been in an accident. But I mean, I know speaking for myself, when I go out on a motorcycle, my son, my daughter, they get worried about it. Like, oh God, I
Hmm.
hope he's okay. And
Yeah.
so it doesn't really, it happens almost indirectly, not necessarily to a person who is actually riding the motorcycle. I mean, have you seen that kind of thing?
Of course. I mean, like when your son or daughter go out on a Saturday night and they're out past 2 in the morning, they're not worried about themselves, right? They know what
Right.
they're doing.
That's
They
right.
have a sense of agency and control,
That's right.
hopefully.
And,
You
just to
don't know
go,
where they are. You have no sense of agency or control.
yeah.
You worry.
And just to go along with that, I mean, my daughter is getting older now. I think she's about 20 now, but, you know, it, I'm worried about what she's wearing. That
Uh-huh.
causes me anxiety, and so just the same, they're worried about what I'm wearing, ironically. They want to know that I'm wearing full protective equipment. So we worry about each other, what we're wearing. I guess we're fashionistas. Um, but there you mentioned another term in there, and you were talking. Well, first let me ask: can somebody recognize when they have anxiety, or can you recognize in somebody else whether or not they're anxious, other than like our sense of being a human being? You look at somebody else and you say, "Wow, you're really edgy." Maybe you use that kind of term, but I guess there's other signs and symptoms of being anxious too, right?
Look, there's anxiety the way we use it colloquially, right? I'm going to be teaching a class for the first time to analytics students, and I'm a little anxious about how it's going to go.
Yeah.
I'm not going to lose sleep over it,
Right. Right.
but then there are the things you lose sleep over, where you're really anxious, concerned. And then there's the anxiety that comes like a Martian invasion
Hmm.
out of nowhere,
Yeah.
and all of a sudden you're feeling like you have to get out of the room. You're feeling like your thoughts start racing. You're feeling like you're going to vomit, or your heart is beating really fast and you're starting to sweat. And those are the symptoms of panic and anxiety that bleed much more into the disorder category.
So that's another term you used. I heard you say something about post-traumatic stress disorder.
Right.
Is that different than anxiety? Is anxiety a part of and I'm going to say PTSD is post-traumatic
Yeah.
stress disorder? Are they part of one another? How does that work?
So PTSD is a disorder that, it's got like a few components. One component has to do with re experiencing the trauma, right? So if you have a car accident or a motorcycle accident and you get PTSD, there's a way that that period of time can lock into place and like freeze in your brain. And you can re experience the same thing over and over again. So you're sitting at work and all of a sudden you picture the brakes squealing and the thing coming at you, and or you wake up and you're dreaming about it, you're having nightmares about it, or you're just having intrusive thoughts and worries about it. So that's one, the intrusive experience and the re-experiencing of the trauma.
So it can almost like freeze you in place. It's a paralysis because you're reliving this moment over and over, and you get paralyzed essentially.
Yes, you can get paralyzed. There's also the hyperarousal. So that's the anxiety, the irritability, the real reactivity that you can feel as a result, of it. There's the avoidance, avoiding anything that, like some people have a bad accident, they won't go back on a motorcycle, they won't get back in a car, they won't take certain roads. So there's the avoidance part. And then the other part, some people have the negative feelings about themselves. So they start to feel depressed, they start to feel shame, they feel worthless, they blame themselves for whatever happened. So those are the main four components of PTSD.
So you mentioned something in there about avoidance. Is that's like avoidant behavior? I guess we can see in a lot of I know a lot of motorcycle riders say they will never drive on a street, and they'll kind of make something up because they don't want to reveal themselves really why they don't want to go on that street. It's because of maybe PTSD, but they don't want to reveal it because they're scared. It's almost like a fear. But avoidant behaviors is really part of how PTSD comes out. Is that pretty much it?
It's one of the yes, it's one of the experiences that people with PTSD have.
Right.
You
And
know,
I mean, these are real things, right? I mean, it's not unnatural to have these feelings or
no,
experience what we're
there are
talking about.
millions and millions of people who have PTSD, and they're not just like your war veterans, and they're not just people who have been like raped or brutally, beaten and mugged. There are people who've had car accidents. There are people who've had health problems. There are people who've gone through really horrific divorces. There are people who have lost loved ones or had loved ones in accidents. So there are a lot of different reasons and ways that people wind up with PTSD.
So a lot of times when people are going through these things, and I have to emphasize to anyone listening, I mean, this is nothing to be ashamed about. I mean, these feelings are humanistic feelings, and it's a natural thing, and nobody really should be ashamed of it. But I think we should all be aware that these things happen and acknowledge that they are real. But they also, I know so many people who have symptoms like this, mental symptoms, if you will, but it also comes out physically sometimes. Like they'll break out in hives, or their eyes will start tearing, and they have no explanation about it.
Where they
And
can't sleep.
right, right. And so I think these physical symptoms can come out. Is there something that, like a category or a name that these physical symptoms might have, or is it just part of the actual anxiety or the PTSD?
I want to just again say PTSD is a diagnostic category,
Hmm.
and you have to meet all these criteria. But a lot of people just have different experiences that are part of it. But just those experiences. Some people just have the avoidance. Some people just have the depression and the self blame and the recrimination. Some people, have the re experiencing and intrusive thoughts and hyper arousal. And so everybody has a different reaction to it. Some people have the physical symptoms. It's really normal reactions. We are programmed to think like, I was in a car accident and somebody crossed a double yellow and crashed into me and pushed me. I had my little one in the back of the SUV, pushed us into a telephone pole. And I'm conditioned to think that people are going to stay on their side of the road. They're not going to do that. So that breaks the idea of safety and predictability in my world. And that is a hard thing to kind of recalibrate. If I'm in a car accident and somebody stops suddenly and I have to stop and I wind up hitting them, that's more normal to me. I get how that happens. The other is more coming out of nowhere. So we all have ways that we see the world and ways that we expect things to be. And when something happens pretty far outside of that, and we have to live with the consequences, it can throw you for a loop.
Yeah, yeah, for sure. I mean, the the thing is, having or experiencing these things, whether it be anxiety, depression, post-traumatic stress disorder, all of these things, we we it may come to a point where we have to deal with it, right? I mean, how how do we know when it's time to deal with it on some sort of psychological level? If somebody's in a motorcycle accident and they're going through all of these signs and symptoms and all these problems, you know, how do they know when to consider going to somebody like yourself or another mental health professional?
There's a saying with eating disorders, early in, early out. And I think it's true with most things. The sooner you go for help to talk about things, to kind of figure out what's going on and how you're feeling about things, the easier it is to kind of reel it back in and get back to yourself. The quicker you deal with the symptoms, the easier it is to tame them and to kind of integrate what's going on. So I think therapy is always a good idea. I mean, I'm a true believer. Sometimes medication is really, really, really helpful.
Right. So when you say like medication, you're talking some sort of like if somebody's having like stomach pains, maybe they need like over the counter something for their ulcer, or are you talking about something else maybe to go see a professional about getting medicine for their mental well-being?
Right. So I'm suggesting that if you have PTSD, the medications that are approved and are extremely effective for that are the SSRI antidepressants. If you have severe anxiety or anxiety for a protracted period of time, or you have depression for a protracted period of time, the antidepressants are the medication of choice for both. They
So,
don't
but
work
there's
quickly,
go
but
ahead.
they work well.
So, but there's other things like if somebody has a problem from a mental standpoint, um, they don't have to exactly jump to medication. There's other
No,
things that they can do, right?
absolute 1000%. I mean, there's always therapy. There's always, I mean, I'm a huge advocate for exercise. Exercise helps absolutely everything.
To relieve the stress and get your mind off of it and
Absolutely.
think about other things that might distract you from whatever's causing the anxiety and the PTSD.
Right. Buy dogs. Get more dogs. Not buy. Rescue.
Yes, dogs often help. I mean, that's a
Dogs
real thing.
always help.
That's a real thing. I know I'm part of a couple of events where dogs and even horses are used to help people going through PTSD. And some of those people have been motorcycle riders. There's people that don't really get on a motorcycle ever again after like a horrific event, and no matter how much medication it is, they just don't get back. But I guess there are different kinds of relaxation techniques besides having pets or like talking to friends and exercising too. I mean, there's more formal relaxation things maybe people
Hmm.
can do, like yoga
Well,
or something like
that's
that.
also part of going to a therapist is a lot of times the cognitive behavioral specialists are very well versed in dealing with trauma, and they have a whole host of different types of relaxation techniques as well as exposure techniques if avoidance is a big issue.
Hmm. Okay. Well, for the people who are in motorcycle accidents or see one super close, a lot of times I hear everybody saying, the best thing for you is to get right back on that motorcycle. If your motorcycle's wrecked, get a new one as soon as possible. Get right back on that motorcycle and get out there. What do you think about that? Is that good advice, bad advice? What do you make of that?
I think it's different for everybody.
Mhm.
Some people it's helpful for. Other people it's not. They're not ready for it. They need to process what's happened. What you
So,
don't want to have happen is you don't want to have somebody to get back on and they're having these intrusive thoughts and memories and they get freaked out while they're riding. So you don't want that. You want them to be ready for it.
yeah, yeah. So it sounds like, just like you said before, I think the earlier you recognize the problem, you get into some help, the sooner you're going to get back out there and be able to enjoy yourself, not only motorcycle riding, but also in life.
Absolutely.
Yeah. Yeah. So, um, there's still, I find, at least in the motorcycle community, a stigma attached to talking to friends, talking to family, or even seeking out a therapist for help with these things. People are somewhat ashamed. Do you see a lot of the stigma still attached to people taking care of their mental health?
I don't know. I know a lot of people that I work with talk to me about how they always talk with their friends about, well, what did your therapist say? Well, my therapist said this, and so it's three-quarters of the world is in therapy. The waiting room is brimming with people. So I don't see, I don't know about the motorcycle culture, but what I would suggest to you is that disorder is at the far end of the continuum.
Hmm.
When things happen, we have reactions. And we need to talk about the reactions and process the reactions. And then if we don't do that, or even if we do, sometimes we can have symptoms. And then the symptoms need to be dealt with because they're very disruptive. And if that doesn't get managed, then they can become full-blown disorders. So going to talk with someone, getting some help, taking some steps, that's just to deal with the problem as it happens. We're human. I don't know how you wouldn't have a reaction when faced with something traumatic.
Yeah, yeah. I think overall, though, it's important to be able to talk about it more freely than even we are now. It used to be much more of a stigma back in the day, maybe in the 70s, maybe even in the 80s, but now it seems to be more popular, if you will, but it's still important to talk about and address. And if you need help, it's nothing to be ashamed about. It's actually going to help you, and it's going to help you get back to normal and get back on your bike. But how does somebody go about saying, look, I have a problem, I have to go find a therapist or the right doctor? What's the best way to try to find somebody?
Most people have an insurance plan.
Hmm.
You find out if you have in-network benefits or out-of-network benefits. If you only have in-network benefits, you get a list of providers. You have more choices, obviously, if you have out-of-network benefits, but you want to call up and ask a few questions. Hey, I've experienced a trauma. Have you worked with people who've had this type of trauma? These are the symptoms I'm having. Is this in your fairway?
So, right, maybe ask them if they've treated people like this before that have been in motorcycle accidents or
Right.
seen somebody in an accident, and maybe they have some experience in doing that. So, I guess a call and just ask a few questions, and you think people get a feeling about, like a good vibe about some people and maybe a negative kind of feeling about others.
Absolutely. I mean, you certainly can go for a consultation too, but I think I wouldn't suggest going for a consultation with somebody who's like, oh, motorcycle accident. That's interesting. I've never heard of one of those. I don't think you
Yeah,
want that
probably not a
person.
good idea.
Right.
You don't
You
want to
want
be the
somebody who
tester.
says, yeah, I've done a lot of work with people who've had trauma.
Yeah. So, and I guess does it matter maybe if you choose, well, we should make an important distinction here. We're talking about psychology, and there is a difference between a psychiatrist and a psychologist. I mean, just generally, right?
Right.
There's a big difference here, right?
Psychiatrists prescribe medication.
Hmm.
So they're medical doctors who have training in psychiatry and, mental health and wellness, and they prescribe medications. There are some that do therapy, most do not.
And the psychologist is more about talking about the issue, how did it happen, and talking about your feelings. And I guess talking about it really is going to help you process it. And as a human being, after we process it, it really gets us back to the norm, or at least that's what we hope, right?
Right. Helps you understand it, helps you process it, helps you figure out different ways to manage the symptoms that you're struggling with.
All right. Well, I hope nobody actually goes through any of these things or any of these symptoms. I really hope not. But if they do, there's a lot of resources out there, and I'll see if I can post some resources on my YouTube channel feed and also my Facebook for people just to take a look at. So, unfortunately, accidents in the motorcycle world happen, and it's something that we unfortunately have to experience. But there are ways to deal with it, and I think this is a really important talk, and I really appreciate you spending time with us to
My
introduce us
pleasure.
to the world of psychology and all that happens in the mind with anxiety, PTSD, and all these things. So I think there's a lot of great information in here. I just wanted to thank you for your time.
My pleasure.
Okay, and that'll do it for us here at ridingcounsel.com. Motorcycle law and charity and everything in between, a guide to riding right. And I'm Rich Jaffe, your host. You can reach me at ridingcounsel.com, and I'll also post some information below. if anybody wants. And that'll do it for this episode. Thanks, everybody.
And that's a wrap for this episode of Riding Counsel with Richard Jaffe. Thanks for tuning in. If you enjoyed the ride, be sure to subscribe, leave a review, and share with your fellow riders. Until next time, keep the rubber side down and ride safe.